This is a presentation to inform the student nurse about the treatment of the skin disorder eczema. Information from the Mayo Clinic website states that the exact cause of eczema is unknown. Eczema is a hypersensitivity skin reaction that can result from a person's response to the environment that leads to a defective skin barrier. Hypersensitivity can be caused by abnormal activity of T lymphocytes. Hypersensitive reactions change the immunologic response to an antigen, and this results in damage to the host. Eczema is a type 4 hypersensitivity immunologic response that results in a particular rash found mostly in children and infants. The process involves haptens, which are small molecules that stimulate the production of antibodies when bound to a larger molecule called a carrier molecule. In the Greek language, the term hapten means to fasten. Haptens, when fastened to a carrier molecule, stimulates the production of antibodies and becomes immunogenic, capable of eliciting an immune response. The results of the reaction is widely distributed pruritic rash with reddened skin and papules that can weep or scale with indistinct borders, and in chronic states there can be skin changes where the skin becomes thickened and leathery, with hyperpigmentation from recurrent irritation and scratching. Suspected triggers of eczema is contact with soap and detergent, fragrances, and sodium lauryl sulfate, a common ingredient in soap that can disrupt lipids in the skin and cause irritation. Ingestion of foods may trigger eczema or make it worse. These foods are milk, eggs, peanuts, tree nuts, wheat, fish, shellfish, and soy. In 2013, the National Institute for Health and Clinical Excellence found there is a genetic relationship in which 60% of children will have eczema if one parent has it, and 80% of children were affected by eczema if both parents were affected. Recommended treatment consists of skin moisturizers. For example, a nurse-led skin moisturizer education intervention resulted in a significant increase in the use of emollients, with an 89% reduction in the severity of atopic eczema. For itching, an antihistamine can be used. The next step, if moisturizers are not effective, is the administration of topical glucocorticoids. If eczema still persists, then the next step is treatment with a topical immunosuppressant. There are side effects with each of these medications. Side effects of the glucocorticoids are skin atrophy or thinning of the skin and loss of pigmentation, spider veins, and in high dose, systemic effects including adrenal suppression. Topical immunosuppressants pose a risk for skin cancer and lymphoma. They work by inhibiting calcineurin, which suppresses the activity of T cells that slows down and decreases the release of inflammatory mast cells and basophils. To use a topical glucocorticoid, one needs to cleanse the skin before application and use the product a few days after the area has cleared, but limit its use to 14 days. Only apply to affected areas. Do not cover with a dressing because this could cause systemic absorption. Do not use on weeping or denuded or infected areas. The nurse needs to instruct the user to report fever or increased inflammation or irritation, and to avoid sunlight on affected areas because burning may happen. Important thing to consider when applying topical glucocorticoids is this medication is contraindicated in viral infections and fungal infections. Topical immunosuppressants. For topical immunosuppressants, the user must apply a thin layer of the ingredient to the skin twice a day for as long as needed and discontinue the product when the condition clears. The nurse needs to instruct the user to report any signs or symptoms of skin infection, such as redness or draining lesions. This may mean that this medication is to be discontinued. Also, Use of the topical immunosuppressants should be reserved as a second-line use in case the glucocorticoids are ineffective because of the risk of skin cancer these drugs may pose. Also, instruct the user to protect treated areas from direct sunlight and artificial UV light sources to reduce the risk of skin cancer. Other treatments that have been effective, and please confer with your doctor before trying, is bathing with a small amount of household bleach in a tub full of water for 10 minutes, then rinse off, dry, and apply moisturizer immediately and generously. This kills the bacteria on the skin. In review, eczema is a widely distributed pruritic rash of reddened skin and papules that can weep or scale with indistinct borders, and in chronic states there can be skin damage where the skin becomes thickened and leathery, with hyperpigmentation from recurrent itching and irritation. Eczema has suspected triggers: ingestion of milk, eggs, peanuts, tree nuts, wheat, fish, shellfish, and soy, or contact with soap, detergent, tobacco smoke, fragrances that can disrupt lipids in the skin and cause irritation. Eczema is treatable. Treatment includes application of emollients and lotions to keep the skin moist. If this doesn't work, the use of topical glucocorticoids can be prescribed by your physician. If this is ineffective, then the use of topical immunosuppressants may be used. That concludes my presentation on eczema.